In this video, we will be explaining how to assess your client's flexibility using 5 different types of tests: the Canadian Trunk Forward Flexion Standard Sit and Reach, the Thomas Test, the YMCA Sit and Reach, the Chair Sit and Reach, and the Straight Leg Raise. Have your client get a brief, full body warm-up to reduce tightness of their joints and ligaments. We will first assess the Straight Leg Raise test. This assesses the flexibility of the hip extenders, which enables the pelvis to move posteriorly. Begin with your client laying flat on their back, relaxed. The tester will then raise his or her leg, ensuring the opposite leg remains in contact with the floor. Using the goniometer, place the baseline edge along the client's torso, adjusting the angle arm to align with the leg that's being lifted, and record your reading. A minimum of 80 degrees is acceptable, but 90 degrees is the ideal measurement. Anything below that is considered non-flexible. Next will be the Thomas test. Your client will remain laying flat on the ground, lifting his or her leg, bending at the knee, and pulling down on the leg to the abdominal area. The tester will determine if the gap between the backside of the knee and the opposite leg is too large and unacceptable. Next, we will do the YMCA Sit and Reach test. You will need a yardstick taped at the 15-inch mark. To begin, ensure that your client's back is against the wall, legs fully extended. The yardstick should be placed between the patient's legs with the 15-inch mark tape at the client's heels. Be sure your client has his or her feet pointed upward and about 12 inches apart. Have your client slowly reach forward with both hands, one above the other, and reach along the yardstick as far as possible without bending the knees. Hold the spot for 2 seconds and record. The hands must stay parallel and not lead with either hand. Allow your client to perform each test twice and record the better of the two, exhaling while reaching and not bouncing. The chart shown categorizes the flexibility fitness for men and women, depending on their reach in inches and their age. The Canadian Trunk Forward Flexion test will begin with your client's back against the wall, legs extended, feet together with the soles against the wall of the box. It is recommended for the clients to remove their shoes for accurate readings. Like the previous test, ensure your client's hands are parallel, not overlapping. Client leans forward, pushing the lever with the fingertips as far as possible, holding it for 2 seconds without bouncing. Get the best of 2 readings as well. This chart shows the Canadian Trunk Forward Flexion categories for men and women divided by their age. It is measured in centimeters. The Chair Sit and Reach is usually done when adults are unable to perform the Sit and Reach test. Begin with a chair about 17 inches from the ground. Have your client extend one leg with the heel on the floor and the ankle dorsiflex, keeping the opposite foot on the floor. Have your client stretch forward as far as they can. The client will be close to the edge of the chair. Obtain his or her reach by measuring the distance between the toes and the fingertips in inches. If the fingertips surpass the toes, the number obtained will be positive. If it is not surpassed, the value will be negative. For best results, measure both legs.